was double vaxxed. I got double vaxxed in 2022 with the first wave of Mpox. I felt like it was this new kind of infection that even the staff, they weren't sure about. They were saying to me, we just don't know enough about it at this point. And because this seems new and a little bit unknown, it had an element of, I was quietly concerned.
Mpox, formerly known as monkeypox, is a viral infection. Mpox is usually a self-limiting disease with the symptoms lasting anywhere from 2 to 4 weeks. The 2-dose Jynneos vaccine can therapeutically be used to prevent symptoms following infection with the virus. This vaccine should be recommended for anyone who is at risk of exposure to Mpox. Initial symptoms can include fever, headache, myalgia, malaise, and swollen lymph nodes similar to COVID or the flu, before progressing to a skin rash or lesions. The rash or lesions can be found anywhere around the genitals and the anus, as well as in the mouth and on the face, arms, and legs.
My initial symptoms were sore throat, runny nose, a bit lethargic. That was on the first day. I noticed I had a small spot near my groin, which that was my clinching deal. I was like, oh, this is definitely Mpox, because it looked like a pockmark that I'd seen online. And the doctor was a little bit dismissive. You know, she was like, oh, it could be this, could be that. I kind of pushed, maybe, you know, let's test. And they took my shirt off and found a lesion on my small of my back, which she swabbed, and that was the positive reading.
People, including those who have been fully vaccinated, can also experience symptoms that include proctitis or inflammation of the rectum, abdominal cramps, increased frequency of stools and tenesmus, myalgia, pharyngitis, and dysuria. If it sounds familiar, that's because it is. Mpox symptoms resemble other common STIs, so it is important to consider Mpox if you have patients presenting with these symptoms.
The first week was actually not too bad. I just had a sore throat and a runny nose. First wave was very mild in comparison to the second wave, which was in the week 2. When that arrived, I felt like I had to keep urinating, but nothing was there. So it was the feeling of having to urinate all the time with nothing coming out, a very uncomfortable feeling in my butt. I thought, oh, this feels like it's something. So I went back, I had a look. There was a pock that they found in my butt. That was the beginning then of the proctitis, which was 3 days of incredibly uncomfortable shitting, I could say that. It was, really, really agonizing for 3 days. After that had finished, all the symptoms from the Mpox started to dissipate. And on exactly the second week from when I was first diagnosed, it was over.
So maybe it's Mpox if your patients have presented with fever, proctitis, headache, abdominal cramps, myalgia, malaise, and pharyngitis. People who have been diagnosed with Mpox need to refrain from close or intimate contact with others, including all sexual activity, until their symptoms are fully cleared.
My advice to people who have tested positive to Mpox: get double vaxxed. You know, it's painless. It's free, and it's available. And I think that if there's a lesion, if there's anything like that, just swab it. It is your best fight against having Mpox.